Hello, I am Dr. Nazira Sadique. I am a consultant obstetrician and gynecologist, senior consultant. I have had more than 27 years of experience in this field, and now currently I am consulting in Cloudnine Hospital, Chennai. See, side effects of postpartum contraception are not very many. See, if you take for instance an intrauterine device, you may have a heavy flow for the first few months, because after all it is a foreign body which has been inserted. So it can take a few weeks or a few months for it to settle down. So you may have initially a extra bout of bleeding, but it can be taken care of. Or you may have intramenstrual spotting. In between periods you may get spotting, but that also can be taken care of. Or you may have some extra discharge, maybe if there is any infection, but then you have to, if you have any foul smelling discharge or any different kind of discharge, you have to immediately consult a doctor, and it may be a local infection which can be taken care of with pessaries or oral antibiotics. But don't remove it in haste. The mild infection can be taken care of, and the intrauterine device can be continued. The benefit is more than the harm. So side effects are very less. And if you want to, in the beginning when you start menstruation, if you want a change or you want to remove an IUCD, it is the ideal time would be to remove it when you are in periods, so that you can switch over from one method of contraception to another. For instance, if you are not very happy with your intrauterine device, you can come within 5 days of your periods, remove the IUCD and immediately start on combined oral contraceptive pills, which is a 21-day pill pack and can be started immediately, and after 21 days you will have a normal bleeding pattern, and if you like that you can continue. So the other side effect is, with the injectables and progesterone only pills, you may go into amenorrhea. Amenorrhea in the sense is you may not get your periods, or if at all you get, the flow may be less. But please don't discontinue based on this one side effect. Injectables, sometimes there may be a very mild weight gain, say up to 2 kgs, but you can keep it in check by regular exercise and diet. Okay, and if you still feel it is not helpful or you are not very happy, after 6 months of delivery or when the baby started weaning, you can change over from the injectable contraceptive to a combined oral contraceptive, which is a 21-day pill pack, which will give you regular menstruation if you take it in the correct way. Okay, so the doctor will instruct you how to take and how to follow those kind of medications. The same way, progesterone only pills also, you might not get the periods. As such, after delivery, when the lady is continuously lactating without any top-up feeds, she may not get her periods. So the idea of introducing postpartum contraception is, when the baby changes over from breastfeeding to top-up feeds or other feeds, then your ovaries suddenly wake up. So when the ovulation happens, you may not be aware of it. So at that time you will conceive. So if you conceive, you may not be aware till you start the vomiting sensation, and you suddenly become in for a shock that if you have not taken precautions, that you are pregnant again and you don't know when you have conceived. So that is the main reason why we advocate postpartum contraception, because when you are lactating, you will not get your periods, and even before you start menstruation, you will suddenly conceive. So that is why we advise all these precautions. So if you are not happy with any one form of contraception, you can switch over to a different form of your choice. So you can even nowadays, they say, earlier we used to say at 6 months. Nowadays they say even within 3 months of delivery, and you're lactating and you want a contraceptive which will give you a monthly bleeding, then you can go for what is called a low dose combined oral contraceptive, a low dose pill. That can also be taken. It will not affect your lactation. because the components are very low in that combined oral contraceptive. So, if you actually think of side effects, then you should not avoid it totally. So, 1 or 2 side effects may be there, but can be tackled, and you can always change over to a different form of your choice. So, if you are not agreeable with one form, don't discard it totally. Go switch over to another form, so that you are protected for 3 years or 4 years or 5 years, as long as you want the gap between the first child and the second child.